Welcome to the Bill and Melinda Gates Foundation-funded Integrated Health System Strengthening Project, a transformative initiative running from August 2023 to July 2027. With a budget of $28 million, this project spans 50 districts across Afar, Amara, Oromia, Sidama, and Somali, covering 5.3 million people. Our primary goal is to enhance the availability, readiness, and equitable utilization of quality health services. We aim to support the design and implementation of a robust platform mechanism for health system strengthening, HSS, at subnational levels. This initiative focuses on integrating key HSS pillars, human resources for health, healthcare financing, data and local governance and management, to improve access to essential primary healthcare, empower communities, and address social determinants of health on the path towards universal health coverage. Our program's theory of change is clear. If we address subnational health system challenges through tailored technical assistance, focusing on optimal governance, efficiencies, and resource mobilization for health and targeted health system improvements, then we will enhance health service readiness and equitable utilization, leading to improved and sustained health outcomes. Throughout this program, we will achieve several primary outcomes. First, we aim to improve primary healthcare governance. This includes enhancing subnational planning and coordination, improving accountability for health, and developing leadership capacity with a focus on equity. Second, we will boost efficiencies and resource mobilization for health. Our efforts will increase domestic and sustainable public and private sector resources, improve harmonization and alignment for cross-program efficiency, enhance allocative and technical efficiency, and strengthen strategic purchasing. Third, we will ensure the availability of essential health system inputs. This involves improving the competency and productivity of human resources for health, HRH, ensuring the availability of essential commodities and technologies, enhancing data quality and use, and providing basic infrastructure and essential amenities. By achieving these milestones, we will significantly improve health service readiness and the equitable utilization of quality health services, ultimately contributing to better health outcomes. Our journey is structured in 4 key steps, and we have already completed steps 1 and 2. Step 1 is co-creation and socialization. This included consultations with the Ministry of Health and regional health bureaus, RHB, on HSS investment intentions, co-developing selection criteria for regions, aligning and agreeing on the PHC assessment framework, and engaging and socializing with selected RHB on HSS investment guided by the MOH. Step 2 is the PHC assessment, divided into 2 phases. Phase 1, from April to June 2023, involved a secondary data review building on WHO PHC measurements, SPA Plus data, PMA data, and insights from the SHPT2 end-term review, along with key informant interviews. Phase 2, from July to December 2023, conducted deep dive WADADA-specific assessments in the targeted 5 regions. We are now moving into Step 3, which is implementation and testing in 15 WADADAs. Here, we have developed intervention packages based on deep dive assessments, create granular WADADA level plans aligned with WADADA-based plans, implement interventions in targeted WADADAs, study the feasibility and acceptability of strategies, document and share learnings, and repackage effective interventions for additional scale-up. Finally, Step 4 is scaling up. We will expand from 15 to 50 WADADAs, share repackaged interventions and learning with stakeholders, integrate tools, guidelines, and strategies with national and subnational standards, and provide technical support for institutionalization and large-scale implementation. Our deep dive assessment of the primary healthcare system has revealed significant insights across multiple dimensions. The PHC governance system scored a robust 82.6 in governance and policy frameworks, but showed room for improvement in engagement with private sector providers at 26.7. Financial systems also need attention, with purchasing and payment systems at 39.1 and funding allocation at 43.4. Physical infrastructure remains a challenge, with critical areas like access to emergency transport scoring only 19.9. However, the health workforce has strong accreditation systems at 95.6, but faces density and distribution issues at 41.3. The health information system's surveillance capabilities are relatively strong at 80.7, but the integration of digital technologies, like EHR, is lagging at 26.6. Performance metrics highlight the efficient health services at 76.2, but indicate gaps in service design at 69.5 and core PHC functions at 40.8. Social determinants of health, such as road access, 70.3, and education, 56.1, also play a critical role. Overall, our PHC index stands at 52, underscoring the need for comprehensive improvements across governance, finance, infrastructure, and workforce to achieve our goal of enhanced health service readiness and equitable access. At the core of our Integrated Health System Strengthening Project is the WEDADA-level IHSS Plan Implementation Support Harmonization Framework. This framework harmonizes funding from various donors, including bilateral and vertical donors, to create a unified investment approach. Domestic funding, alongside contributions from Bill and Melinda Gates Foundation and other partners, supports the government-led WEDADA-specific IHSS implementation plans. These plans are guided by the One Plan, One Budget, One Report principle, ensuring streamlined and efficient resource utilization. Technical support from implementing partners, universities, public agencies, and the local private sector further strengthens these efforts. The government's role as a dealmaker is pivotal, proposing priorities and minimum investment contributions for matched donor funding. This harmonized approach ensures that investments are effectively channeled through grantees to implement interventions based on deep dive assessments, ultimately enhancing integrated service delivery at the WEDADA level. To ensure the successful implementation and realization of new interventions and initiatives, we follow a structured 5-stage GATE process. This begins with the idea phase, where new concepts are formulated. Moving to validate, these ideas are assessed for feasibility, criticality, and associated risks. Upon passing validation, the plan phase involves developing detailed implementation plans and assessing their potential impact. Next, the implementation stage focuses on executing the plan, tracking progress, and ensuring all deliverables are completed. Finally, in the track phase, we monitor and evaluate the outcomes to ensure the results are realized. Each stage requires sign-off and validation from key stakeholders, including the WEDADA Health Office Head, the AMREF IHSS team, partners, RHB heads, and Bill and Melinda Gates Foundation representatives. Our approach to integrated health system strengthening, IHSS, is a collaborative effort where governments own and lead, donors coordinate, and the Bill and Melinda Gates Foundation IHSS orchestrates. The IHSS investment is secured upfront through aligned commitments, triggering a positive chain reaction. The government takes the lead by setting investment priorities based on a unified plan and commits funding to match and multiply contributions. Funders, including the Bill and Melinda Gates Foundation grantees and other partners, align their funds to support WEDADA IHSS plans. This coordinated effort follows the unified investment approach of one plan, one report, one budget, ensuring streamlined and efficient resource utilization. This strategic collaboration ensures that all stakeholders work together towards our shared goal of strengthening health systems and improving health outcomes. Gender integration is vital to the IHSS project. We focus on supporting community accountability and advocating for women's leadership. We use gender disaggregated data in health management information systems and consider gender needs in healthcare financing. In supply chain management, we ensure the availability of essential health commodities, including family planning supplies. The success of the Integrated Health System Strengthening Project is driven by a dedicated team. Backed by the Bill and Melinda Gates Foundation, this team forms the backbone of the initiative. Their collective expertise and dedication are instrumental in planning, executing, and evaluating interventions, ensuring progress towards achieving better health outcomes for all.